lady. Good afternoon to everyone. Thank you for joining me for today's weekly update. We have a couple different issues to cover. Specifically, I want to talk about the issue of prison space, and then secondly, we'll give our COVID report. I'm joined by Secretary Solomon Graves, who does an incredible job of leading our Department of Corrections, also by Dr. Jennifer Dillahay from the Department of Health, and we have Gina Wendell, Chief of Staff of the Department of Education. So let me first start with our prison space. Over the past 2 years, the Arkansas Department of Corrections saw a decline in prison population, but it was artificial. It was largely due to COVID and the restraint on bringing prisoners into the system. But the projections show that population of prison inmates will continue to increase over the next 10 years. Because of this growth, we need to add additional prison space to house these offenders. The first responsibility of government is public safety. That's a big responsibility for our state, and it rides on my shoulders, and I look at our prison population, and we need to address the issue of adequate space. If you will recall through history, when I got elected, it was recommended that we have spent $100 billion on expanded prison space. We reduced that to a $50 million plan, and we added prison space. And we also adjusted our laws that would put more in the parole system versus the prison system. We enhanced our ability to supervise that, and you'll see some of the results of that today. But even with all of that, we are growing as a state in population, and obviously at some point you have to continue the increase of prison space. For all of those reasons, I'm supporting a plan to utilize part of our surplus to expand the North Central Unit in Calico Rock to add approximately 498 additional prison beds. This is almost 500 beds, of course. The cost is not fully determined, but it should be way less than $100 billion, somewhere between $60 and $100 billion, but those costs will be computed more carefully whenever we have architectural design and more planning in place. I approved the planning for this project some time ago, and the Department of Corrections received approval from the Board of Corrections just this week, and I wanted to announce my support of it. For this step, they will be in the process of soliciting plans from architecture on this project, and they will continue to move forward with this. And I wanted to provide a little bit more history with this. So let's look at these graphs, and these are projections. The first one is historical and projected Department of Corrections population. And whenever you look at 2015, that's the red line, is the historical part. We've been consistently about 16,000 in our prison population, and then you see that drop, and of course the drop is artificial because of COVID, and then the projection, of course, is to see that move up. It grows about projected growth is 1.4% per year. And so with that, obviously, we need additional prison space anticipating the future. And then I want to do a further breakdown on the next chart. This is just between male and female. The male is in the blue and the green is female, and it just shows you, of course, the disparity and how when you build prison space, you've got to keep that in mind and have the right balance so that you meet the needs of all the inmates in terms of space. And then if you look at I want to break it down to the admissions to the prison system, and the green are parole violators and the red is new commitments. And it just goes to show that we are using the parole system, and whenever you look at, let's say, 2015, which is right in the middle, you see the green was 5,000 parole violators that came into the system, and that's remained fairly consistent. You see on that last column that we still have 5,400 parole violators coming in the system, but the red number are those that are first-time offenders or commitments, and that was reduced. Once again, everything slowed down during COVID, but obviously that's going to come back very quickly as we see our case numbers go down. I believe that we have one more here, and this is something that illustrates the need. This is our county jail backup numbers. And you hear our county sheriff speaking of this, and it puts a burden on them. And so whenever I became governor, well, way back before then, it looks like, these are county jail backup totals by month from March of 2020 to 2022. And we've tried to manage it more in the 1,400 level is what I like to see, but we see it now at 2,251. It was up to 2,345 in January. This number is too high, and it does not give our local court system enough flexibility to arrest people on misdemeanor offenses and to have adequate space in their county jail for other purposes. And so we need to get that backup down. Now, as you build more prison space, this is going to be relief down the road, but it takes time to build a prison. In the meantime, I've instructed and asked Secretary Graves to be sure that we work to reduce that backup. It was artificially high again because of the slow intake through COVID. But we've got to relieve the pressure on our counties, and so we want to see that number reduced. And I've challenged Secretary Graves to help in that end. This whole project is needed for a couple of reasons, of course. There's needed space in the prison system because of natural growth, and secondly, we also have the backup in the county jails that we want to relieve over the long term and have a permanent solution for this. And so with that, we'll take questions a little bit later on in reference to this, and Secretary Graves will be available as well. And then let me go on to our COVID update. Since last Thursday, active cases have been cut in half. From 49,764 down to 24,200. Hospitalizations have decreased by 348 in the last week. Unfortunately, our deaths continue to go up, and it will not be very many days until we reach the 10,000 mark in terms of Arkansans who have died as a result of COVID. Vaccinations have slowed as well. In the last week, only 17,000 doses have been given. This is an average of 2,400 doses per day. We hope that that will increase, but with our numbers going down, that's going to be a challenge to get people's attention and realize the importance of that. But we want to continue to encourage vaccination, as you'll see from the data. And so you're looking at the data for the last 24 hours. We've given out 3,800 doses, and our immunizations that are fully have gone up about 1,200. If you go back to, I think we've already covered the other slides as I was speaking, but let's look at the deaths. Well, let's start right here. This is plus 10 in deaths. It's down. That's going to go up. There's a timing issue there, so that's encouraging, but we expect that to go back up. It's just a tailing indicator again. Our active cases have gone up 1,800, which is down from last week. The next one, here's the doses given I've already covered, and is there another one? The hospitalizations down 66, ventilators down 5. And then you go to the next chart, we'll see it just in graphic form. This is the number of currently hospitalized. And now you see the number hospitalized, 1,257, is lower than it was at the peak of the Delta. So that is very good news, that trend line for our hospitals, relieving some of the pressure there. The next one, you'll see how steep the rise and decline of Omicron has been. Steeply goes up, and just as even more quickly has gone down, and we trust that that will continue in the coming days. Again, we always like to remind everyone as to what it looks like in terms of the data on those that are having new cases that are infected. 72% of those of new cases have not been fully vaccinated. When it comes to hospitalizations, 81% of those that are being hospitalized have not been fully vaccinated. And most significantly, when you see approaching 10,000 deaths, many of those happened before we had a vaccination. But those that happened after we had the vaccine, it's really very difficult to look at this statistic that 82% of those were not fully vaccinated. So with that, I hope that that is an encouragement. Our positivity rate continues to go down. It's down to 17.4%. We're not to 10% yet, but we hope that that will continue. With that, let me ask Dr. Dillahay for her comments, then we'll come back for questions.
Thank you very much, Governor. There's a couple of things that I would really like to emphasize today, and that is that people who are fully vaccinated and boosted are much less likely during the Omicron surge to get infected, to be in the hospital, or to die from COVID-19. I very much want to encourage people, because our cases are still rather high, we're not where we need to be. If they're not fully vaccinated and boosted, to go ahead and take steps to make that happen. We know that just a little over 2% of the people that have been reported to die since the beginning of December have been fully vaccinated and boosted. So we know that these vaccines can greatly protect people. So I encourage people to do so. Thank you.
Thank you, Dr. Dillahay, and with that, we're happy to take any questions.
So with the vaccinations as low as they are right now in terms of people getting vaccinated, what's your strategy for changing that, or do you think it can be changed?
Well, our strategy will be to continue with our marketing campaign, encouraging vaccinations, both in terms of public marketing, but also in terms of community action. We still have vaccination clinics that are produced locally. We encourage everyone to go see a trusted medical advisor to get the right information to make the right decision. And so that's the strategy. Everybody knows from our repeated encouragements, but also the data as to the benefit of the vaccine, and we want Arkansans to make the right decision.
Do we have a cost or timeline for the prison expansion?
In terms of the cost, we do not have firm figures because we don't have the architectural design yet. But from the information I have, we'd estimated around $60 million, but that's why I said between 60 and 100 million, because that's a lot of beds. We want to wait till we get the architectural design in first before we really put a 100% number on that. In terms of the timeline, let me ask Secretary Graves to come and to address that.
Thank you, and I actually want to first begin by thanking the governor for his continued commitment to public safety in general, but specifically to the Department of Corrections. Since we began this administration, we've brought online 680 new beds that we've been able to net with his support, so I wanted to acknowledge him for that. For the timeline piece, we will have plans back this spring, and by law, those will be reviewed and approved by both the Board of Corrections and the governor before we move forward. Once those plans are approved, then the construction has to be reviewed by our state building authority, and they have a separate timeline that they have to work on there. But my goal would be to start construction in the first half of 2023. 23.
23. So is this something that the legislature would have to tap surplus funds, and where would you, what funds would you use? Would it be a catastrophic fund?
Well, first of all, absolutely, this is supported by the Department of Corrections, and I support this. That's my announcement today, but the General Assembly controls the purse strings in terms of appropriations, and it would have to have their support. And that's why we're bringing this forward now, is because we have a fiscal session that starts next week, and we want this on the table. As to the source of funds for this, my proposal is that it comes out of the current surplus that will be generated that we'll talk more about, but right now there's more than sufficient in our current surplus to cover this kind of expenditure. This is a one-time expenditure in terms of the investment. Obviously, when it's online, there'll be operating costs, but that can be dealt with in a future budget session. But this would not be catastrophic reserve. That's set aside. We want to keep that at a high balance. This is our current surplus that we'd look at, and it would take legislative support.
So the surplus we're accumulating this fiscal year?
Correct.
Okay.
That will be available June 30th. Let's go remotely. Are there any questions?
Yeah, Governor, it's Mitch McCoy at Channel 4. What do you consider fully vaccinated, and have you considered changing what fully vaccinated means to people who have received the booster? And if you don't mind, could we get an update on how many people have received the booster shot?
Okay, I'll ask Dr. Dillahay to come if she has that data. But in terms of fully vaccinated, this is speaking of the original vaccination shot, which in the example of Pfizer is a two-shot regime. So it's fully vaccinated in the sense of the original shots, and then so it doesn't include the booster shot. In terms of how many booster shots that we have given, Dr. Dillahay, can you comment on that?
Well, we do not have those data with us right now. We do have the number on our website, but I don't know that number off the top of my head.
Did I describe that right on what we consider fully vaccinated?
Yes, fully vaccinated are people who have received their primary doses, and then if someone has been boosted, we consider that person up to date. And that's what we're hoping for, is everyone will get up to date with their vaccines, because the doses needed, including the booster dose, has changed as we have had various variants arise, including the Omicron variant. And it could be that we'll have another variant in the future.
Thank you. Next question.
Good afternoon, Governor. Brett Raines with 4029 News. Good to talk with you. Regarding the upcoming fiscal session, is that your main priority and focus, the additional prison space? Can you highlight some other top priorities that you're hoping to see accomplished? And then for context, for additional prison space, is this something where we just expect to see an ever-increasing number of prisoners and where we're always going to need additional space in the future?
Well, in regard to your first question as to other issues that we'll have to address in the fiscal session, I'd like to keep the focus on the investment in adequate prison space and public safety today. As I give my State of the State address next week, we'll be outlining a number of different items then to highlight those priorities during the fiscal session. In terms of the ongoing needs as to prison space, regretfully, as you grow in population, historically, the prison population grows as well. We're a growing state, and so if we can't eliminate crime, they're going to have to make sure public safety is guaranteed by incarcerating those that are violent or career criminals, or those that are necessary to confine. We're always looking for ways to do right by our criminal justice system. We've had different types of reforms in the past that have had some impact on our prison population. We don't always get it right perfectly, and so we adjust it again, balancing making sure that our violent criminals have adequate time in prison, that are punished adequately, and the public is safeguarded. But we also always are looking at our nonviolent offenders, whether we're getting that right, making sure that we have adequate parole officers, making sure our investments are sufficient for both policing but also the supervision that is necessary. But I do expect, and that's why we have this projection, it looks like a 1.4% growth rate that's being projected in the future. So we'll see if that is accurate, but we've got to be able to plan on that future and have adequate space.
Governor, this is Alex with KNWA. I'm in Fayetteville. We've heard from some pharmacies here that they're still not having received the free N95 masks from the federal government. Do you have any update on the distribution of those masks?
So if I heard the question right, you have a number of people that have contacted you and said they have not received their N95 mask from the website, from the federal government, as they go on the website and order that. The answer is we're very glad that we were able to get our state distribution out and make sure that those masks were available. And then secondly, I have not heard anything more in terms of the federal mask and their delivery dates. So I hope that people are receiving those, and that's an exception, but I have not received any additional details.
Governor, this is Zoe in Channel 5 in Northwest Arkansas. A lot of states are putting a hold on gas tax. Is Arkansas looking to do anything like that?
I'm sorry, you're going to have to say that again a little bit slower.
A lot of states are putting hold on gas taxes. Is Arkansas looking to do anything like that?
A hold on
gas
tax. I'm sorry, I do understand it now. In terms of a hold on gas taxes, with the information coming out today, the new data on the record inflation increases, it is obviously a concern to us that this is really hurting Arkansans as they go to the pump, as they're trying to get to work, provide for their family. This is very, very burdensome. There's not been any specific discussions on a suspension of the gas tax, but we know that that is hurting, and we hope that we can have better controls from the federal level on that increase of inflation. We'll continue to look at that, and we know that that is a real challenge for Arkansans. With that, thank you all very much for your attention today, and we'll see you next week.